to get us to the main event and welcome Melissa Long, who is going to be talking to us about our brain health today. So welcome, Melissa.
Thank you for having me. Give me 1 second. Let me just share my screen here. Let me just flip it to the other one so you're not seeing all my notes. All right, awesome. Everything is up and running. So my name is Melissa Long, and I'm the Director of Education and Support at Insight Memory Care Center. And a little bit about me. Yes, I have lots of letters after my name. I hear that a lot. I'm a recreational therapist by trade. I've worked in the field for over 20 years. And I've worked with all different ages, but most specifically with the dementia world. So I'm a certified dementia practitioner, a dementia capable care specialist who deals with trauma. I'm also best friends certified, and I'm instructors for 2 of those certifications as well. So those are what my letters are for. So let's go ahead and get started on better brain health as you age. So at Insight, our mission is to provide specialized care, support, and education for individuals in all stages of memory and cognitive impairment, their partners, and our community. Our vision, a community where those living with memory or cognitive impairment and their care partners can achieve the highest quality of life. We're a leader in dementia care and happy to say that we've been going strong since 1984. This is our 41st year. We provide care and specialized adult day programs for people in all stages of dementia, from early stage all the way to hospice care. We're the only one within a 500-mile radius that does that. We also build connections and relationships and supporting care partners on this journey. And creativity, our dementia experts sharing their knowledge and resources, because every journey is unique. So what is brain health? Important question. We all think we know, but let's find out what it is. It actually refers to how well our brain is working. So it's like our little engine. It controls everything. And it's in several different areas. It's in our cognition, sensory, our social and emotional, our behavioral, and our motor domains. And so we want to make sure those are all working. That means we have a healthy brain. So when we look at cognitive, it's how well a person can think, learn, and remember. When we're looking at the sensory stuff, it's how well a person can feel and respond to sensations of touch, including pressure, temperature, and pain. When we look at the motor ability, we're looking at how well a person can make and control movements, including their balance. And when we're looking at the emotional and behavioral, we're looking at how well a person can interpret and respond to our emotions, both pleasant and unpleasant. So when we look at brain health, it can affect many age-related changes in our brain. Injuries such as strokes and traumatic brain injury can affect how our brain works. Mood disorders such as depression and anxiety. When you look at substance abuse and addiction, that can affect it. And cognitive degenerative diseases such as Alzheimer's disease and other dementias. According to the National Institute on Aging, around 20 to 25% of older adults can expect mild cognitive impairment. So this is the diagnosis before dementia, and anyone at any age can have mild cognitive impairment. This is very common for caregivers who have a very stressful job. And this is where it ties all of you in. So estimated 1 out of 10 older adults will experience some form of memory loss or dementia. So if you get told you're 32 years old, you're stressed out, you're a caregiver, and you get told you have mild cognitive impairment, the first thing I want you to do is look at that doctor and say, from what? The reason why I want you to ask that question is because most of the things that cause mild cognitive impairment can be improved. So it could be depression. It could be sleep deprivation. It could be low vitamin D, low vitamin B6, low vitamin B12. It could be anxiety. It could be a urinary tract infection. Those things can be fixed. We can take care of those things. When you don't get the help for these and take care of them, they can become permanent, which is then with those 20 to 25% of people that have mild cognitive impairment, 10 to 15% of them end up with dementia. Okay. So we want to be proactive about that. So what can we do to keep our brain healthy so we don't end up in that situation? A healthy diet can help reduce the risk of many chronic diseases, such as heart disease or diabetes. It may also help keep your brain healthy. So in general, a healthy diet consists of fruits and vegetables, whole grains, lean meats, fish and poultry, and low-fat or non-fat dairy products. You could also limit solid fats, sugar, and salt, and be sure to control portion size and drink enough water and other fluids. Drinking water is so important. There's so much to not drinking water, from being hypotensive, so you have low blood pressure and then you pass out. It also helps keep those kidneys going so you don't get urinary tract infections. As caregivers, we do a really bad job of taking care of ourselves because we're taking care of everyone else. Obviously, the most common healthy diet is the Mediterranean diet. It's 7 years running being the number one to eat. We are in America, and that's hard sometimes to do, especially with the economy. So do the best that you can for this. Next, I want you to get your annual health screenings, including the recommended ones. As a caregiver, we always put everyone else first, and we forget about our own health appointments, whether that's getting our flu shot or getting a mammogram or going in for our annual physical and getting our blood work. We also want to manage these chronic health problems like diabetes, hypertension, high cholesterol, mental health. These are important because they can lead to that mild cognitive impairment even at a young age. I want you to consult with your healthcare provider about the medicines taken and their possible side effects on overall brain function and sleep as well. Just because you've been given something doesn't mean it's the right one for you. And it's really important to advocate for yourself and ask questions. And I tell people the best person to ask questions about medication is actually your pharmacist, not your doctor, because the pharmacists know all the medications and they can do a reconciliation on your meds. So utilize your pharmacist. Reduce risk for brain injuries due to falls and any other accidents. How many times as a child I hit my head doing different things? And it was not normal like soccer and football. It was falling backwards, playing indoor volleyball, and getting hit with a broom during acting class and all sorts of weird things. So if you have lots of those, you may be prone to dementia later. And that goes into the diagnosis of CTE, which you hear a lot of football players and veterans have. I also want you to reduce your intake of alcohol. Take a strong caution if you're mixing with medication. We have found more prevalent since COVID, an increase in a dementia that is actually induced by alcohol. And it's usually early onset diagnosis. So you're talking mid-50s if you're a chronic drinker. And it's kind of like, if you ever seen the movie 50 First Dates, that's kind of what your symptoms look like. And so that is becoming more prevalent. We're seeing a lot more of that. The other thing we want you to do is quit smoking if you currently are, in addition to avoiding other nicotine products such as chewing tobacco, and then get enough sleep. This is probably the hardest thing for people to do. We are really bad with technology nowadays and have our phones and iPads and all those fun things going on, and don't turn them off and don't do the healthy sleep routine of not doing technology an hour before bed and all that kind of stuff. So we have to do better about that. And the reason that one's important, they did a research study right before COVID that they have found that a lot of people that had high stressful jobs that didn't sleep well, so you don't get past the REM stage, past that dreaming where your neurons can rebuild, we're actually finding people get early onset Alzheimer's and dementia. And it's becoming more prevalent. We have someone here at Insight that was very high up in the Coast Guard. And when 9/11 happened, she was sitting on a ship for 2.5 years protecting our coast and didn't sleep. She now has early onset Alzheimer's. And so we're seeing a lot of that with those type of jobs that people had. So it's something really to pay attention to. So studies have shown that having hypertension between your ages of 40 and 60 increases your risk of cognitive decline later in life. For example, the SPRINT Mind study, a nationwide clinical trial, concluded that intensive lowering of blood pressure lowers the risk for mild cognitive impairment, which is a risk factor for dementia. So really important to take care of those. Hypertension's dealing with your blood vessels that goes straight to your brain. Okay, so taking care of that is really important. All right, so we're going to eat healthy. We've got that healthy diet. We've talked about that Mediterranean diet and drinking lots of water. And a healthy diet can help reduce the risk of many chronic diseases, including diabetes and heart disease. A healthy diet can also lead to your better brain health. So let's look at those healthy foods. We got fruits, mixed berries. Those really help reduce inflammation, and inflammation is tied in with dementia. Pineapples, kiwis, bananas, vegetables, eating those dark leafy greens, your broccolis and your beets. With meats and fatty fish, so some salmon, sardines, those wouldn't be my first choice. Chicken, beef, and then whole grains and legumes, having oats and chickpeas and lentils, kidney beans. And then we want some healthy fats, so that olive oils, nuts and avocados, herbs and seeds, cocoa seeds, rosemary, mint are good for you. Calcium, getting your dairy and vegetables, tofu and fruit. and then 8 to 12 cups of water a day. And if you're not someone who likes to drink water, is it Crystal Light you mix in it? Is it that you eat more Jell-O? You can eat oranges and watermelon. They have a lot of water in them. So you can find other ways to get your water. But please do remember, if you're drinking caffeinated drinks, that takes away from the water you drink. So that doesn't count even if it's an instant tea. It still has caffeine. So here's our healthy plate. So as you can see, half the plate should have greens, tomatoes, bells, peppers. Your dessert is oranges and fruits. You have a quarter of your plate is the fish, grilled salmon, and then the other quarter is your grains, garbanzo beans, kidney beans, things like that, and then your glass of water. Also, when we look at portion size, you should be able to drive a matchbox car between all your food. We as Americans like to have really big portions, but that's not necessarily the healthiest choice. So if you are going to eat not so healthy foods, make sure they're not all touching, because that shows that you have smaller portion sizes. All right, we want to get physical and get active. So a healthy diet can reduce the risk of many chronic diseases as heart disease and diabetes, may keep your brain healthy. But being physical is the next step. So active through regular exercise, household chores, or other forms of movement has benefits. It can help you keep and improve your strength, have more energy, improve your balance, prevent or delay heart disease, diabetes, and other concerns, and perk up your mood and reduce depression. So I always tell people, if you can't get to the gym 30 minutes a day, if you can at least get outside for a walk or run in front of the TV for 30 minutes while you're watching I Love Lucy, whatever works. That way you can get some exercise in to take care of yourself. If we look at older adults, age 65 and older, they need at least 150 minutes a week. So 30 minutes a day, 5 days a week of moderate intense activities, such as walking. Alternatively, they can do 75 minutes a week of vigorous activities, such as hiking and jogging. At least 2 days a week of activities that strengthen your muscles, because as you age, your ability to maintain your strength for your balance does go down. So going upstairs and ramps are a really good idea, keeps up your muscle mass. Activities that improve balance or flexibility, such as yoga. The other thing I tell people to do is stand at the kitchen sink, use your opposite hand to brush your teeth, and stand on one foot. That works on your balance and your brain all at once with cognition. Easy, simple thing you can do. So when you take care of your physical health, you take care of your cognitive health. So we want to improve our body compositions. We want to improve our blood and lipid profiles and our vascular function, improve our immune system. This is really important with all those things going around, having school-age kids, and they bring every germ home. Increased muscle mass and strength, greater oxidative capacity, improving that physical function and mobility, improving your blood glucose and insulin sensitivity, and improved blood pressure. So these are all really important, and doing these things helps with that. So exercise brings in your improved mental health, your help with controlling your weight, reducing your risk of heart disease. It'll likely help you quit smoking because you can't run when you smoke very well, reduce your risk of falls, and strengthen your bones and muscles. So some exercises I want you to think about doing. Brisk walking, everyone can do that. Cold outside, go to the mall and do it. I actually have a galley kitchen in my house. So my first floor, it's like a big circle. So I can actually kind of run track in my house. Light jogging, strength training. You can lift up cans of tomato soup while watching TV. You don't have to have weight in your house. Water aerobics is a great one. If you have access to a program at a community center, it takes away having to balance too much, but it works really good on your muscles and your strength. Biking is always great. Doing Pilates and yoga. You can find a lot of this online on YouTube free. You don't have to pay for a membership somewhere to do it. So that's always a great thing as well. I want you to speak with your doctor before starting any regimens if you have any health risks. Super important. So next is our brain. We need to exercise it. This is really important that, we get really tired and sometimes we don't pay attention to what we're doing, and we forget about us and doing these brain exercises, okay? Because we let our brain kind of go to sleep when we're taking care of people and we don't do the crossword puzzles and things like that. So lots of activities can help your mind be active. For example, reading the book, reading a magazine. I just found on the Libby app for the Fairfax County Library. I did not know we had access to all the magazines for free. That got me very excited the other day when I figured that out. So you don't even have to pay to look at all the magazines if you look at them on a tablet. You can play games, do family game night, take or teach a class. Learning something new is so good for your brain. It builds new pathways. Or do a new hobby. Working as a volunteer is another one. A lot of people like to do the Duolingo app because you're learning just a couple words a day with a new language, which is a big hit and a great thing for your brain. So now I'm going to exercise your brain. So you guys can turn on your microphone and let's see what you know. All right. What book did Rudyard Kipling introduce readers to? A mongoose named Rikki Tikki Tavi. Anyone know? All right.
And sorry, Melissa, I'm just going to jump in here. If folks are more comfortable chatting their answer in, I will be watching that. So
Thank
if
you.
you know the answer, but you don't want to shout it out, feel free to put it in the chat box.
I actually don't know.
It is The Jungle Book.
Oh.
All right. In what country was Arnold Schwarzenegger born?
Slovakia.
I think Austria.
Yeah.
Austria, correct. Who was Germany's first female chancellor?
Angela Merkel.
Yes, Angela Merkel. Very good. What is the main source of food for the bald eagle?
Fish. Salmon.
Yeah, fish. Correct. All right. What language do natives call Farsi?
Arabic. Good force.
Iran?
It's
No.
Persian.
Pakistan.
Persian.
Persians.
All right. This is my favorite one. What was the first toy advertised on television?
Barbie.
No, it was not Barbie.
Potato Head. Miss Potato.
Yes, Mr. Potato Head. You are correct. No one has ever gotten that right. You get the extra gold star today. So doing little things like this, and they have tons of these trivia programs on YouTube, and you can pick the themes of animals or food or things from the 60s or in the 90s or songs or logos. Tons of those things are really easy to do to just keep your brain exercised. So those are great sources for that. All right. So studies suggest that informal cognitively stimulating activities such as reading or playing games may lower the risk for your cognitive impairment and judgment. So participating in games, crafts, computer use, and social activities for about 4 years was associated with a lower risk of MCI, that mild cognitive impairment. So we want to keep doing that no matter how old we are. Scientists think that some of these activities may protect the brain by establishing a reserve, the brain's ability to operate even when it's damaged or some brain function is disrupted. And I'm sure you guys have heard of studies where a child was born with not all of their brain, but they are functioning as if they had their whole brain. Our brain can rewire things. So don't be afraid to do things to help build that and put that reserve, as they call it, so that we have those ability to do things. I'm going to skip that slide. All right. The power of socialization. This is really huge. This became very prevalent in COVID, and we saw a major change with this. If you guys have ever heard of a continuing care community, that's a senior community for people with independent living all the way to hospice care. They pay into these communities. And I had a client who was in the independent living, had mild cognitive impairment, and because they were isolated and told they couldn't engage because of COVID, within 9 months, she was in the memory care. That lack of socialization made her plummet with her cognitive ability. And so socialization is huge. And we saw this across the board with people during COVID. So really important. Those with large social networks are 20% less likely to develop dementia than those in the tiny networks. Resilience to stress is greater among those who are well established with a support system. So especially in these day and age right now with everything going on. Having your support system is huge to get through this, and staying socialized, no matter how hard it might be, and you may not want to do it, make yourself. So connecting with other people through social activities and community programs can keep your brain active and help you feel less isolated and more engaged with the world around you. Participating in social activities may lower the risk for some health problems and improve your well-being. People who engage in personally meaningful and productive activities with others tend to live longer, boost their mood, and have a sense of purpose. Studies show that these activities seem to help maintain their well-being and may improve their cognitive function. So some of those can be joining a group, getting a pet, teaching someone something, volunteering or helping others, using technology to stay connected if you can't physically go somewhere. I have a group of friends. We have played Cards Against Humanity on Zoom since COVID, and we're still doing it instead of getting together. It works for us. So you can still use technology for that stuff. And then always share a smile. We all need that. I had someone randomly had a conversation with me a couple weeks ago in the grocery store. It's probably the first time in a long time that's happened. And I think we both needed it with everything going on. So I encourage it to help us get through those things. Stress, the natural part of life. Chronic stress can change our brain permanently. We all can deal with acute stress that goes away. But when it's something that's long-term, it can definitely do a brain change. It affects our memory, increases our risk of Alzheimer's and related dementias. So to manage stress and build the ability to bounce back from these situations, there are many things that we can do. So exercising can help with that. Writing in a journal. And it doesn't have to be anything crazy. It can be a one-liner. You can write one positive thing of the day. Practice mindful meditation. Some people can do it in a quiet setting and just have music on. I'm not that type of person. I need guided imagery. And there's tons of that online for free. And I am depending on that right now with everything going on. That's really helping me. Releasing grudges or other things beyond your control. You know, we can't always fix everything going on, but we can focus on ourselves in our immediate circle of people. So I want you to practice gratitude or pause to enjoy the simple things like the comfort of a cup of tea or the beauty of a sunrise. We kind of forget about those things when things get stressful. So really looking at those little things. So next thing we're going to look at is meditation. And so this can look different for everyone. It can be walking meditation, it can be yoga, it can be guided imagery, it can just be sitting and listening to quiet music. But what does it do for us? Well, it boosts our immune system. It helps manage pain. It can improve our sleep. It helps stave off depression, can help with our attention span, lowers blood pressure, helps our memory, and reduces anxiety and stress. So we want to help promote cognitive aging, our sleep benefits, enhancing our concentration, promoting normal cholesterol levels, assisting in pain management. And so I want us to practice that a little bit. And I want to go ahead and have you guys close your eyes, and I'm going to do a meditation with you and just help you relax going into this evening. So I'm going to have you close your eyes, and I invite you, when you're ready to take your next breath, to simply be more conscious and allow your breath to bring you into the present moment here and now. I want you to breathe through your nose, inhale the cool air, and nurture yourself. I want you to exhale the warm air and expel any tension and negative emotions. I want you to feel your feet connecting you to the floor and the earth below. Gently correct your posture by slowly lifting your chin until the top of your head radiates up towards the sky. Relax your shoulders down like ice melting on a hot spring, and feel your neck grow nice and long. Relax your forehead and relax your eyes. Now let's relax our jaw and then our ears. You feel your earlobes stretching from the relaxation. Relax the muscles in the back of your neck. This is where we hold a lot of our tension.
Oh, Mimi.
And I would like you to go ahead and take a deep breath in and let it back out. And breathe back in and let it back out. Now relax your forehead and your eyes again. And then notice your breath and allow it to bring you into the present moment where you're safe, relaxed, and doing something positive. Try to quiet your mind, even when it's not easy. Let your thoughts go by like leaves floating in the mountain stream. Bring your attention to your breath again and breathe in and breathe out. Breathe in again and breathe out. I want you to disengage from the past and from the future and just be here now in this present moment and enjoy this present moment fully. Deep breath in and deep breath out. I want you to imagine that you're sitting on the shore and you hear waves. You can smell the sand and the salt water and the sunblock. And breathe in, take in all those scents, and breathe back out. Be in that moment. Cultivate your inner peace. A safe place in your heart. It's filled with love and light. Give me one more deep breath in and out. And when you're ready to come back, you can open your eyes. I hope that made you guys feel more relaxed. So when we look at our cognitive health, it's not always about the things we do sometimes. It plays in with our genetics too. So it's not, just environmental or lifestyle factors, though we can play a role in that. So I want you to do the things that you can do in your environment, do the things that you can in your lifestyle, but also know you can't fix it all doing that way, and to have peace with that a little bit. So some of these factors may contribute to a decline in your thinking skills and the ability to perform everyday tasks such as driving, paying bills, taking medication, cooking. When you're really stressed out and you can't do some of those things, it's time for you to step back a little bit and see, can someone else do it? Can I relook at how I'm doing things? We are really bad as humans multitasking, and we're multitasking too much. And as we age, everyone's brain shrinks. That's part of normal aging. And we keep trying to do that capacity of things, and we can't. And at being a caregiver, when you're stressed, we still try to do all the things when we can't. So do we need to make a list? Do we need to put reminders on our phone? And you can set that in different ways on phones. If it reminds you when you get to an address, or reminds you a certain time of day, you can set all those things up to help yourself. It's not saying you're in a bad place or that you can't do things. It's just helping you be more successful, and having less to remember can be helpful to help you get through those things. Genetic factors are passed down and inherited from a parent to a child and can't not be controlled, but many environmental and lifestyle factors can. So just remember, get that physical and mental health under control with your high blood pressure and depression, getting those treated, keeping fewer brain injuries due to falls and accidents. Keep an eye on your medications and make sure that they're not affecting you in any way. Keep yourself busy doing activities, both socially and physically, making sure you're eating correctly, not smoking and drinking to an excessive amount, keeping an eye on that healthy sleeping, and making sure that you don't allow yourself to be lonely. So if you have good heart health, you have good brain health. And that is the end. I'm open for questions. You can go on our website and see all the other classes that we do. But I hope that was helpful to you guys. I can preach this all I want, and I still don't do all the things. So I'm not expecting you to walk away and be your best self immediately. But please know that doing one thing is just as good as doing two or three. So.
Thank you, Melissa. If you guys have questions, you are welcome to either raise your hand or just unmute, or you can put them in the chat. Sherry, I see your hand is raised. I'm not sure if that's from now or from earlier. Up, unraised. Got it.
I'll share that at least one individual shared that the meditation was extremely helpful and appreciated. Wonderful. So thank you for that, Melissa.
And I can share with you, there's a for you. There's actually a woman who's out of Maryland. Her name's Bella Ruth Napperstack. And she does some amazing guided imagery. I actually utilized her when my husband was deployed. I could not sleep. She has a sleeping meditation, but she also does them for PTSD, cancer, stress, all these different things. And her voice is just lovely because that can be one of the things that can throw you off for meditation is not having someone with a good voice. And she has all these different ones for different traumas and stuff. And she's actually on Spotify. So you can get most of her stuff on there. And if you have Spotify, if not, you can also find her, buy her CDs and stuff. I actually still have hard CDs of hers because I found her that long ago. But she is lovely.